everyone, my name is Caitlin Sheffy. I am a licensed life and health insurance agent in 47 states. I have been doing this for over 3 years, and today we will be talking about Medicare. So let's take a deep dive into the parts of Medicare. If you're taking notes, this would be the perfect time to make like a 4T chart where you have A, B, C, D. And then somewhere at the bottom of the paper, I would put Medigap / Medicare supplements because I'm going to go over all of it. Now, I'm not going to go into too deep detail like I would on a one-on-one consultation, but I just want to make sure that you got a pretty basic understanding so at least you feel comfortable asking. I'm really shy asking questions when I absolutely know nothing about anything, but here we're going to get out of our comfort zone and hopefully you have the confidence to actually reach out and ask those questions. So we'll begin with part A. So part A on your red, white, and blue card will say, I think it'll say hospital or inpatient. Whichever, think of it as inpatient. Anything that you're doing where you're staying overnight, that is going to be part A. So this is going to be hospital stays. This is going to be skilled nursing facility. And this is also going to be hospice. Don't really want to get too much into that because I don't want to get everyone sad. But those are going to be the 3 things. On your notes, I do want you to put that it does not cover long-term care. Long-term care means they don't think you're ever going to leave. This, for example, is going to be Alzheimer's disease. You're probably not going to leave there unless your family finally does take you. So that's going to be an example of what long-term care is, and that is not going to fall under Part A or any part of Medicare. I do want you on the bottom of that paper where we just put long-term care is not covered, that you do need to purchase a separate policy if you want your long-term care covered. You can reach out to me, ask those questions about what I mean by that. But I just want to make sure that you know that that is not covered. I get so many calls when crises happen and these things, it's just a mess. But let's go back to Part A before I start rambling again. Part A can be premium free. Premium free means you don't have to pay a premium. Now, you pay towards Medicare your whole life, and if you have 10 years of paying into Medicare, this is where you're going to see that you don't have to pay a premium for Part A. If you pay 5 years, you're going to see a premium. If you pay 0 or if you've not paid any years into Medicare, you'll see that full premium. Normally it's several $100s, so it's best just to work your 10 quarters. Now, if you were married and you're going on your spouse's quarters, we can use that. Medicare will be able to use that. But just so you know, for most Americans, Part A is going to be premium free. Now, what is this covered? Normally, it's going to be 80-20, meaning they pay 80, you pay 20%. There are a couple holes in there, and Part A really does break down really strange. But essentially, just for the sake of this video, let's think of it as 80-20. They pay 80, you pay 20. Now, it does not have a stopping point for that 20%, meaning if you got $1 million bill, you pay 20% of that, no ifs, ands, or buts. Now, Part B is going to be the next step. So Part B is going to be your medical coverage. Medical coverage is going to be things like surgeries, doctors, preventative care, specialists, testing, things like that. I do want you to put on here that your preventative care is covered at 100%. Now, preventative means your regular go to get checkups, things like that. We can further investigate into that preventative services on a one-on-one or just, through DMs. For the sake of this video, just put preventative care 100%. Now, Part B does have a premium that you do have to pay. So Part B is $175, give or take a few cents, this year on your monthly premium. It does have a deductible. It's a little bit easier to understand than Part A because there's not as many holes. Part B has a $240 deductible for 2024. So you have a $240 deductible, you have a $175 premium. Now, after you reach that $240 deductible, it's 80/20, similar to Part A. Let's do an example. You have a surgery first thing in the year for $1,240. How that bill's going to look is you're going to pay that first $240. You have $1,000 left. They're going to pay 80%, so they'll pay $800. You'll pay that $200, which was 20%. So out of that $1,240 bill of the year of that surgery, you pay $440 and they paid $800. Now for the rest of the year, you have to pay 20%. Scary thing is it doesn't stop. So if it was a $20,000 surgery, you're paying 20% of a $20,000 surgery. That's the scary part on that. Now, I do want to go over how A and B work together. So A and B is what's called original Medicare. When you first turn 65, they normally enroll you in Part A, no matter what. No matter if you did have employer coverage or whatever covers, they normally automatically enroll you in Part A. Now, Part B, some people can hold off on Part B depending on if they kept their employer coverage, if they have credible coverage and they're holding off on Part B. So if they did hold off on Part B for credible coverage reasons, then they don't have any penalty when they get Part B. Now, if you do hold off on getting Part B after you're 65, let's say you finally decide to get it at 69, you can face penalties, and you also can only enroll in a certain time of the year to get Part B. So even if you're fine with the penalties, you still have to wait for that certain enrollment period to enroll in Part B. So it's better to know exactly the enrollment periods, get an agent to help you or Medicare. You can actually call Medicare directly so they can advise you on, how to enroll, what's the best thing for you to kind of avoid something like that where you're restricted from even signing up for something. Now, the next part we're going to get to is Part C. This is the Advantage plan. This has A and B like coverages, meaning they are going to cover inpatient, they are going to cover medical. They'll just cover it at a different cost share. Now, this is also from different companies. So this is the plans that you see like Humana, United Healthcare, Blue Cross Blue Shield, Better, Devoted, the list goes on. I'm not favoriting those, but this is what you see when you hear of Part C Advantage plans. So these private companies are offering Medicare Advantage plans to you, where instead of having original A and B, you would choose to go with C. Now, if you did decide to go with an Advantage plan, the cost doesn't change for Part A and Part B. So if you were having to pay a Part A premium, you still have to pay it if you're on an Advantage plan. The Part B premium that you're paying, the $175, you still have to pay it with the Advantage plan. Now, if you chose an Advantage plan that didn't have a premium, then that's the only thing you're responsible for as premium is going to be that premium that you're paying to A and B. Now, if you did choose an Advantage plan that does have a premium, you're going to have to pay the Part A premium if you have one, Part B premium, and the premium for the Advantage plan. Now, most of the time, Advantage plans, Part C, they do contain prescription drug plan coverage, which is what we'll go over next, which is the Part D of Medicare on your paper. So before we get over there, just put drug coverage. This does contain Part D. Now, next part is sometimes Part C offers additional coverage, such as things like help with your groceries. Sometimes they offer like a $50 grocery card every 3 months, or over the counter, or dental coverage. When I was going over A and B, you didn't hear me mention dental because Part A and Part B doesn't cover dental. Sometimes Advantage plans have these incentives where you can actually have some dental coverage through them. Now, with the Advantage plans, you are no longer following Medicare's rules. So Medicare Part A and Part B allow you to go to any doctor in the U.S. that takes original Medicare. Now, with the Advantage plans, you do need to follow that Advantage plan's rules and make sure that that plan rules you're more than happy to oblige to. For example, if it's an HMO or it's a PPO, make sure you see your service area and you're comfortable with that. Make sure you're not traveling somewhere. If you are traveling far through America, make sure that you pick a plan that will cover you doing that. Now, the next part we're going to go over is Prescription Drug Plan Part D. This is also through a private company such as, Aetna, Cigna, all these, United Healthcare, all these companies. So if you have Part C, you do not purchase a prescription drug plan unless it did not come with one. So if you have Part C, it's kind of everything put together under a different plan. Now, if you decided you want to stick with A and B, you liked how it covered, you liked the doctors that you could go see, you liked the flexibility, then you would get a prescription drug plan through a private company like Aetna and things, SilverScript, things like that. So the prescription drug plans are very complicated. I can make a whole 30-minute video on it. But basically, there are certain formularies, which is basically a list of here's the prescriptions we're covered, cost share, and things like that. So you want to make sure whatever prescription drug plan that you picked, that the prescriptions you are currently taking are under them, and that it's just it's a decent premium for you. Premiums can range on these plans, anything from $0 all the way up to $100. It really just depends on your medications you're taking and which is the best for you. Now, you would only choose Part D if you have A and B, then you get Part D. Now, if you have a Medicare Advantage plan, remember, you do not need Part D unless it does have it with it. It actually won't let you have both. Now, the next part of the Medicare consult is going to be the Medigap and supplements. So what this is the Medigap Medicare supplements. They actually fill in original Medicare, which is A and B. I'm going to go over a very common one that's super easy, and that's going to be the Medigap Plan G. So the Medigap Plan G, they say, hey, you follow Medicare rules, do whatever you want. We're going to fill in the gaps. And what those gaps are for the Plan G is, hey, we're going to fill all the Part A gaps. We're going to fill all the Part B gaps except for that Part B deductible. So that means you go to the hospital, they're going to pay those holes that I didn't get into. They're going to pay into all those little holes, those deductibles, and the 20%. Meaning you go to the hospital for 90 days, you're covered at 100% for those 90 days. Now for Part B, let's use that scenario of you going to have a surgery that's $1,240. So if you're on Part A and Part B and you have that Medigap Plan G, that's going to cover the 20%, but not that initial deductible of $240. So you have that surgery, that's $1,240. You pay $240, you don't have to worry about anything else. Same thing, if you have a $20,000 surgery, and let's say you already hit that $240 deductible, you don't have to pay anything out. Now with the Medigaps, you do have a monthly premium. They can vary on age and things like that, and they are offered from a private company. Now all the supplements, they are standardized in the plan letters. So a G from one company is the same exact from the other. They will fill in the gaps the exact same. Now I do want to make sure that you are, when the time comes to enroll in things, and I would say 4 or 5 months before you turn 65, talk to an agent about these enrollment periods. You do not want to procrastinate. You do not want to get behind, because there are so many penalties associated with Medicare and so many restrictions that you just really don't want to play around with these, and just have an agent on your side to make sure that you are getting these things submitted and taken care of, and make sure they really listen to you. All these plans have their clients. All these plans are good for certain families while not good for certain other families. So really just talk to an agent, express your concerns, and express exactly how you want your plan to look, and I'm sure someone's going to find them. I'm really great at it, but you don't have to choose me. I do want to thank you so much for joining my video and watching. I hope I helped. I hope I educated. I hope you came in here and learned something that you didn't know and you left just a little bit more smarter about Medicare. If you have any questions, feel free to reach out. I hope you love this video. I hope you love me, and just subscribe, like, all of that jazz. And I hope to answer your questions. If y'all need me to help you get a Medicare and You book, feel free to reach out. I'm more than happy to send you that information over on how to do that. But anyways, y'all have a fabulous day. Thank you so much for everything, and y'all have a great day. Bye.